This is Dr. Kevin Palmer. Today we're going to be discussing how to perform a PRP injection for the Achilles tendon. I have paused here to discuss a few things before we actually perform the blood draw itself. First, you can see that I am holding the actual syringe to draw the blood up with myself. I'm the one with the black shirt on. This syringe needs to be primed before the blood is drawn. You need to push the plunger in and out several times to ensure that it is freely mobile. One very important thing is to let the patient know that they need to come well hydrated for the blood draw. You can see there's a tourniquet wrapped around this patient's left arm as my assistant with the blue glove is just about to make the needle stick and blood draw. Of course, the skin is prepped with alcohol before this blood draw. The tourniquet is removed before the needle is withdrawn. Here the needle is being inserted in just far enough to where the blood is easily withdrawn. Once the blood is being withdrawn, you should avoid moving the needle if at all possible. You can see my assistant tried to remove the tourniquet but wasn't able to without moving her hand. Once I complete the blood draw, I will remove the tourniquet myself. You can see here that our syringe is completely full. The needle is then withdrawn and gentle compression is applied. The blood is then concentrated down with a centrifuge into our PRP mixture. In this freeze frame you can see lidocaine in the syringe to my right, and I'm marking out the Achilles tendon with a pen to find the maximum point of tenderness for this patient. I mark out the exact spot of where this is the most symptomatic, and I then perform a field style block proximal to the Achilles tendon pathology. The PRP is generally injected with an 18 gauge needle, so anesthesia is required. I will generally make several passes and place the needle into the tendon itself to provide a microtenotomy type procedure as well as a PRP injection itself. You can see the left Achilles tendon is significantly enlarged compared to the right in this particular patient. Once the local anesthetic is injected, the PRP injection is a fairly painless procedure. You can see I've marked out the most superior aspect of where the tendon is symptomatic as well as the most inferior aspect, so as to provide local trauma to that specific area. Again, the skin is cleansed with alcohol, and then a local field injection is administered with 1% lidocaine. Ethyl chloride is utilized to numb the skin topically prior to this injection. Generally, 10 cc's will give an adequate block for this procedure. In this case, I'm injecting laterally first, placing a large amount of anesthetic near and around the sural nerve, and then I angle my needle medially so as to hit any branches off the posterior tibial nerve in this distribution as well as the skin. Once our anesthetic takes full effect, we are ready for our PRP injection itself. A PRP injection can take several weeks or a month to feel the full effect. Unlike a cortisone injection with PRP, you are actually injecting platelets and growth factors directly into the area of pathology so as to allow this to heal as opposed to just treat inflammation. This patient had undergone a round of conservative treatment, including physical therapy, for approximately 1 to 2 months before deciding that PRP injection was warranted. You can see here our blood draw yielded approximately 4 to 5 cc's of excellent PRP. Although I shouldn't have recapped this specific needle, I realize that the patient needs a larger diameter needle, so this 25 gauge is being switched out for an 18 gauge needle. Adequate anesthesia has been obtained, and now we inject our PRP. I inject the PRP in several different planes as marked out before in an attempt to cause a microtenotomy to the specific area of symptomatology. Additionally, you can feel when the PRP is inside of the tendon sheath as opposed to in the body of the tendon itself. You can see I've injected approximately half of the PRP more proximally, and now I'm placing the PRP and causing a microtenotomy more distally so as to hopefully provide growth factors to the entire area. The needle is passed in a sweeping style motion with deep and superficial stabs in this microtenotomy fashion. My post-injection recommendations generally include pain medication and weight-bearing to tolerance. I recommend that patients don't apply any ice or use any sort of anti-inflammatory so as to blunt this healing process. I generally allow Tylenol or conventional pain medication only. This patient was sent for physical therapy approximately 1 time per week for the next 4 to 6 weeks after this injection. He ended up following up approximately 6 weeks after the injection, and he had 0 pain and no signs of any sort of antalgic gait. This is not necessarily what you'll see in every patient, although usually for tendon or soft tissue pathology, PRP works quite well. For arthritic joints in the foot and ankle, I have only seen limited improvement. To minimize any sort of chance for infection, I place Band-Aids on each of the puncture sites with antibiotic ointment. I do recommend that the patient leave this intact for at least the next 24 hours since we used a larger gauge needle. I feel that there's a slight chance for infection with an 18 gauge needle for injection, although I haven't seen any complications thus far. Coban is applied to keep these Band-Aids in place as well as to provide compression over the site of injection. Thank you again for watching this video on PRP technique. Please send me any sort of feedback or if there are other videos you might request. Thank you. Kevin Palmer, DPM.